Al Jazeera Podcasts.
Today, citizens of the world's richest country are being priced out of healthcare.
Millions of Americans who take advantage of the Affordable Care Act could see their health insurance costs skyrocket next year.
How will cuts to public and private health insurance impact Americans? I'm Malika Billal, and this is The Take. Hey everyone, as you're watching today's show, leave us a comment letting us know what you think about this episode and what stories you want us to tackle next. And if you're listening on a podcast app, leave us a review telling us where you're listening from and a rating. 5 stars would be great. It helps other people discover the show. Thanks.
My name is Dylan Scott. I'm a senior correspondent covering healthcare at Vox.com.
Oh, Dylan, welcome to The Take. It's good to have you here. So, healthcare costs are in the news with the recent end of the U.S. government shutdown, which we will get into. But I want to start with our international audience, because the United States is not like other wealthy countries in terms of how people access healthcare. While the norm in many other places is universal healthcare, the U.S. healthcare system is aggravatingly complicated, to put it lightly. So how do you explain it to people outside of the U.S.?
Yeah, I do think the most significant difference between the U.S. health system and the health system of any other wealthy country in the world is that we do not have universal health coverage. We have never made a collective decision as a society, as a government, to say we're going to cover everybody. And so instead, we've kind of patched together this healthcare system that does cover most people, but it doesn't cover everybody. And even the people who do have health coverage, it's not always very good coverage. They can still end up on the hook for thousands of dollars of medical costs in any given year. So the bedrock of the US system is what's called employer-sponsored insurance. Basically, people get insurance through their jobs. Their company contracts with a health plan and pays a lot of the premiums, which are these monthly payments that we make to health insurance companies. But obviously, that's not like a universal healthcare program. A lot of people are not working age. And so that's why in the 1960s, the US created Medicare to cover the elderly, people who are more retirement age and who, of course, have really serious medical needs. And then Medicaid, which covers lower income people, the poor. And that's been a program that's been expanded over the years to cover more and more low income families and children especially. So that's what makes up kind of the majority of the US healthcare system. And we've kind of been adding patches, trying to fill in holes over the decades. And the most recent example of this was Obamacare, the Affordable Care Act. And that program was specifically really targeted towards adults who are of a working age, but either don't get insurance through their work, maybe they're unemployed, or maybe they're self-employed, maybe they just work at a small company that can't afford to provide insurance benefits. And so we've gotten to this point now where we have seen big improvements, but there are still a lot of Americans, about 30 million Americans who do not have health insurance coverage. And like I said, even for a lot of the people who do have coverage, because the costs of both insurance as well as the costs of medical services keep rising, healthcare is still a really big expense for people, still one of the leading causes of bankruptcy for people here in the United States. My colleague Sarah Cliff once reported on a guy who lived in San Francisco. He was walking down the street and basically he got clipped by this bus walking down the street. And so he's knocked out. He gets put into an ambulance while he's unconscious and taken to the emergency room and ends up with like a $30,000 emergency room bill that obviously he could not afford. We're still a long way from like a really functional healthcare system that delivers cares to people in a financially affordable way and doesn't set somebody up to, lose their house, lose all of their savings because they end up in a car accident or something like that.
So Dylan, it is open enrollment season, which is the short window of time every year when people can sign up for a change to their health insurance. And for a lot of people, logging on to the online marketplace they might be panicking right about now, looking at these premiums.
My January premium will just skyrocket. They said there will probably be a 15% increase on plans across the board, plus lose subsidy. So my plan without the subsidy right now is almost $600 a month.
There are a couple of reasons for these increased costs. That includes Donald Trump's big, beautiful bill that passed this summer and some other cuts and rollbacks that actually shut the U.S. government down this fall. Can you walk us through briefly what's happened this year to make these prices skyrocket?
Yeah, there are two things that are happening simultaneously. First, there is just the steady increase in healthcare costs. And that's just because of inflation and the steadily increasing costs of medical care. Those obviously get absorbed by the health insurance companies, and they increase your premiums to cover those increased costs that they're anticipating next year. So that's one piece of it.
Yeah.
But then you have specifically people who buy insurance through the Affordable Care Act, through Obamacare.
I mean, if it goes down to not being on the Affordable Care Act, we would just have to completely cut the insurance, not even have insurance, just go with the flow.
For those people, the law provided financial assistance to help them afford their healthcare plans. For some people, the government ends up covering almost all of their health insurance premiums. So that's just the way the ACA is structured. There's about 20 million people who buy health insurance on those marketplaces. But during COVID, Congress basically decided that they should increase the assistance that was available to people who bought insurance on the Obamacare marketplaces. The thinking was, we're in a public health emergency. We want people to have health insurance in case they need medical services. So basically, for the last couple of years, the actual premiums that people have been asked to pay on the Obamacare marketplaces have been really depressed because of this enhanced financial assistance that Congress authorized a couple of years ago. People who have been getting these enhanced financial subsidies for the past few years are now logging on. Congress has not authorized any kind of extension for those subsidies. And so the financial assistance that's available to people has shrunk. It's smaller. And therefore, the premiums that they have to pay themselves out of pocket is a lot higher. I mean, I talked to one guy. He is he's a father, a husband. He's in his mid-40s. He lives in South Carolina. And this past year, he actually bought a separate health plan for his wife because she has autoimmune disease. So she needs, she needs robust benefits. They know she's going to have appointments and medications she needs to take. So they want her to have a really good plan. And then he and his daughter were on a little bit skimpier plan, but they had coverage. And so he logged on this past couple weeks to see what his new premiums would be for last year. The cost of his wife's plan in 2025 was about $50. When he logged on to look at the prices for next year, it was almost $300. So that's like 5 times what it was, or 6 times what it was this past year. And so the way he put it to me, he was like, I logged on and I just immediately I closed the computer. I closed out of the website. I didn't even look for a plan for me and my daughter, because now he's just trying to figure out where am I going to come up with an extra $250 a month to cover my wife's health insurance plan? And so what he's thinking about doing is just going uninsured, him and his daughter, and then they'll find the money to pay for his wife's plan because they know she needs it. But that's the experience that people are having in these past couple weeks during an open enrollment, because Congress has failed to act to extend this enhanced assistance that has allowed millions and millions more people to get health care through the Affordable
So Dylan,
Care
then
Act.
just to be clear, people are making this difficult decision, this fork in the road, and one of the choices is I'll go uninsured. If you go uninsured, then what happens?
Then you're basically making a bet that you're not going to have a really serious medical situation next year. I mean, that's, as this father told me, he's like, my plan is to schedule as many appointments as I can before the end of the year. Well, before his current coverage runs out, stockpile medications if he can. And then, like I said, his current plan is for him and his daughter to go uninsured. And They're going to pray and see what happens, is what he told me. And so, yeah,
because
there's...
if something were to happen, to pay out of pocket would be a ginormous bill.
Again, if you're that guy walking down the street, you just get clipped by a bus or a car or something, suddenly you're in the ER with a $25,000 hospital bill. And yeah, if you don't have insurance, you're on the hook for that. And you either got to figure out a way to pay it, you got to negotiate yourself with the hospital to try to bring it down. I mean, it's a nightmare situation to kind of to try to navigate, to end up in that kind of scenario where you either have an accident or maybe you get like a serious diagnosis, like God forbid, you get diagnosed with cancer, some kind of chronic or even terminal illness. Like now you're going to be on the hook for all of those medical costs until next year when hopefully you could then sign up for an insurance plan. But yeah, it's literally like, it's a gamble.
We'll have more with Dylan after the break. Well, Dylan, as we've referenced earlier, you know that we have just emerged from the longest U.S. government shutdown in history, 43 days. And the standoff was over healthcare subsidies. Now, the heart of the issue, the unaffordability of healthcare, hasn't really been resolved, even though the shutdown has ended. And this is worsening for millions. Now, to offset this, President Trump has proposed sending direct payments to people so that they can choose their own health insurance.
And I'm calling today for insurance companies not to be paid, but for the money, this massive amount of money, to be paid directly to the people of our country so that they can buy their own health care, which will be far better and far less expensive than the disaster known as Obamacare.
How do you read this proposal? Would that work?
It makes sense to me politically because Republicans, that one of their big charges against the Affordable Care Act, which all Republicans have opposed, they tried to repeal it during Trump's first term. They have often said basically Obamacare is just this sop to insurance companies. There's all this financial assistance that gets funneled to them. And so maybe it would be better, therefore, to give that money directly to people. What doesn't make sense to me is like, in a way, that's what we're already doing. Like when somebody logs on to the ACA and sees their premium and sees how much whatever subsidy they qualify for is lowering their premium, like that's sort of the same thing. So I imagine what Trump is envisioning is we're going to give money directly to people and they could go buy health insurance like products that are not compliant with the Obamacare's rules around things. People outside of the US, thankfully, never have to know what pre-existing conditions are and things like that. But basically, short version is, in the US, before the Obamacare, a health insurer could just refuse to cover you because you had a heart condition or something like that, a pre-existing condition.
Yeah.
And Obamacare said, no, you're not allowed to do that anymore. That kind of discrimination is not allowed. People like Donald Trump and a lot of Republicans have kind of held up as like, well, Obamacare, it had too many regulations and all those rules, even the rules around pre-existing conditions, those are the reason that health insurance is so expensive. And so it would be better to just give people money. And if they want to go buy like a skimpy plan, then people should be allowed to do it. But the problem is you would basically end up with a bunch of people taking money from the government and going and buying these insurance-like products that don't actually provide them protection in a serious medical situation. They can just say, we're not going to pay any more than $10,000 for your medical costs this year. And so that might sound like a kind of good deal if you're not expecting to get sick, if you're a young and healthy person or something. But again, I go back to the guy who got hit by the bus. Boom, You get hit by the bus. They're only going to cover $10,000. You're on the hook for the other $15,000.
Right, because the trick is no one expects to get sick, but we know that at some point we are going to.
We all get sick. We all have accidents. And yeah, that is what insurance is meant to guard against.
Well, Dylan, it's interesting because the Republican Party has made health a center point of their platform, but not necessarily access or affordability.
Our big priority will be to clean up the public health agencies like CDC, NIH, FDA, and the U.S. Department of Agriculture. Those agencies have become sock puppets for the industries that they're supposed to regulate.
You have covered healthcare and public health through multiple presidential administrations. So I'm wondering if you feel like there's a disconnect between both parties and the needs of their constituents?
I do think what's different about this Trump administration and the Make America Healthy Again movement that is led by Robert F. Kennedy Jr. is I do think there's sort of two elements to it that I think are distinct and that sort of factor into how they think about these issues, which is they're really all about sort of the individual pursuit of health. It's really like, we're going to empower people with wearables, with health apps, with, this sort of like idea of open and free science, do your own research, that kind of thing. And so they don't like, and so that's, I think it naturally follows like Trump's proposal, like just give a person money and let them do what they want to do. They want to kind of pull the government out of healthcare as much as possible, leave it to individuals. And I do think in some ways that's kind of disconnected from what we really need, because like a healthcare system is a system. Everybody is a part of it. If you go to the emergency room and end up, needing $50,000 in medical care and you can only pay for $5,000 of it, that other $45,000, it's not like the hospital is just like, oh, well, too bad. They're going to increase the prices that they charge for people who do have health insurance. And so there's all these feedback loops, like we're all in this together. And so I do think it's kind of misguided at the end of the day to be like, well, people should just look out for their own health. People can just pay for their own health and, and have this kind of individualist mindset about it, because that's not how the healthcare system actually works. And so in that regard, I do think that like their prescription doesn't really meet the diagnosis or the problem. But what's sort of different now on top of that is the Trump administration and the health department led by RFK Jr. is like openly antagonistic to the healthcare industry, the healthcare establishment, the public health establishment. Like it used to be that like, sure, we might kind of argue about, how to pay for medical care, but we probably all basically agreed on like what kind of medical care is important, what kind of medical care is valuable, whether you asked the federal government, your individual doctor, or a medical society, they'd all probably tell you the same thing before this administration. But these days, you're hearing one thing from the federal government about how vaccines cause autism and Tylenol cause autism and all these things that then, your individual doctor or these medical societies would not agree with. So it's a much more confused information environment. And there's a lot more tension between the federal government and the healthcare industry and the medical establishment, which I think makes it harder for like everybody to come together and figure out what to do and how to fix problems.
Well, Dylan, as we wrap up, I want to talk then about solutions, because we've heard the problems, we're living through the problems. You have reported from countries like Taiwan, Australia, the Netherlands, and the UK to understand how other wealthy nations do this, how they deliver universal health care. And while we're talking about how dysfunctional the U.S. healthcare system is, it is worth noting that there are complaints in those countries as well, that universal healthcare does not necessarily mean a perfect system by any means. So when thinking of a perfect system for us here in the U.S., what are some of the drawbacks to universal healthcare that we can keep in mind when we're trying to devise what we should do here?
It's a really good question. And look, I do not view it as my job to, propose solutions to fix the health system. That is a problem for all of us collectively. But I do think you're right. Like one of the things that I learned the most from reporting on healthcare in other countries is that every system has trade-offs. No matter how you set it up, there are whether it's a totally public system or a totally private system, either way, there are going to be trade-offs. It's just a matter of which trade-offs are you comfortable with and sort of how do you live with them. And so, to give a couple of examples, maybe in terms of how I think about this, like Taiwan, for example, is a single payer system. The government basically funds healthcare for everybody. And that's great. People are mostly happy with it. But it does mean that, like, there are high-price specialty drugs that the Taiwanese system does not always cover or doesn't always cover right away. It does mean that, like, they're trying to figure out, like, how do we cover long-term care? Like, that's not something that we were included in our single-payer system initially. And if we're going to cover that, like, how much will we have to raise taxes or cut payments to other healthcare providers in order to do that? So, yeah, when you're talking about a totally public system, what is the actual level of access? And oftentimes, more specialized treatments, certain kinds of maybe more cosmetic elective surgeries, like those are not going to be covered in a totally public system because they're really expensive. And that's, that is a trade-off. It may be that really only people who are super wealthy can afford those kinds of things that you have to pay out of pocket for in a public system. And that may be worth it. It may be worth it having those inequities in order to provide like a baseline level of coverage to everybody. But like, that's one way of thinking about it. When I think about the US, to be honest with you, and to break my own rule about prescribing solutions, I think about Australia, which has a program, ironically, that they call Medicare, that everybody qualifies for. It is a baseline, like universal public health insurance program that everybody is able to access. But on top of that, there's a really robust private healthcare market and private health insurance market. And again, that's more for people like upper middle class and above who are able to afford those plans, who therefore can go to these doctors. And so that's like a system that I think worked for them. There's a certain egalitarianism to it. Everybody qualifies for the public program, but there's an individualism to it too. Like if you can afford it, you can pay for better healthcare. And I could see something like that working in the United States. But what we have not done, to kind of return back to the beginning, is we've not made the decision to have that universal baseline. We have not made a collective decision that healthcare is a social good. It's a human right, to borrow the language that people sometimes use here in the US. And therefore, we're going to kind of start from the premise of we need to cover everybody and then figure out how to do that. That is sort of, in a way, the first step that the United States has never taken. And until we do, we'll probably continue to be, patching or attaching new limbs to the Frankenstein monster of a healthcare system that we have.
Wow, what a horror story. What a way to end this. But I think you're right, Dylan. Thank you so much. Your latest piece is out now. Meet the Newly Uninsured on Vox.com. You've been talking to people from across the country, and it's really fascinating and also slightly heartbreaking to hear what people are going to be going through. Thank you for walking us through those stories.
Thank you for having me.